Good day everyone. Before I start, please allow me to introduce myself. I'm Nelly Elasib and I'm assigned to report the visual impairment. So this passage explains that visual impairment is a broad term used to describe individuals who have difficulty seeing even with corrections. So the Individuals with Disability Education Act or the IDEA defines it as a visual impairment that negatively affects a person's educational performance. So there are different classifications of visual impairment, including the legally blind, totally blind, partially sighted, and low vision. So each classification describes the level of vision that an individual has. With legally blind and totally blind, individuals having very limited or no vision, while partially sighted individuals have some perceptions of their environment, and people with low visions have residual visions that can be improved with the help of devices, but they still have difficulty reading and seeing objects at a normal distance. So moving on, let's now proceed with the causes of visual impairment. So the first one, we have myopia or nearsightedness. So the individual can see clearly if the object is close to him. So this is the result when rays of light from distant object are not focused on the retina. So it is very understandable now that the person with myopia or nearsightedness, they can see the objects clearly if it is close to him. So the second one is we have hyperopia or farsightedness. So this is the opposite of myopia or nearsightedness. So the person can see clearer if the object is far from him, and in this condition, the light rays near the object are not focused on the retina. So hyperopia is, as what it definitions, it is opposite of myopia or nearsightedness, in which the person with disability, they can see the objects clearly if it is far from him. So the third one is we have astigmatism or blurred vision. So the person sees a blurry image of the things around him due to the curve in the cornea or lens. So as a result, the curve prevents light rays from focusing the retina, So just like myopia and hyperopia, astigmatism can be corrected through the eyeglasses and contact lenses prescribed by ophthalmologists or optometrists. So astigmatism is nakakakita ang mga tao ng mga bagay sa paligid ngunit hindi ito malinaw dahil sa kurba o cornea o mga lens ng mga mata. So the fourth one is we have cataract. So the person with this condition experience a blurred, distorted, or incomplete vision due to the cloudiness of the lenses because of trauma or old age. So cataract is sila yung mga taong may ganitong kondisyon na nakakakita ng malabo at hindi kumpleto o deformed ang naimahe ng mga mata dulot ng trauma o dulot ng kanilang pagtanda. So the fifth one is we have the glaucoma. So the condition occurs when the aqueous fluid fails to circulate properly. So the pressure in the eye caused by the fluid can damage the optic nerves and can further result to loss of visual acuity and visual field. So the person may experience headache and fatigue. So glaucoma is ito yung condition na nagaganap kapag hindi maayos na napapalitan ng aqueous fluid sa mata. So ang pressure ay dulot ng fluid ay maaaring magdulot ng pinsala sa optic nerves at magresulta sa pagkawala ng visual acuity or ng ating mga paningin. So the sixth one is we have diabetic or retinopathy. So from the name itself, diabetic individuals have affected with this type of eye disorder. So this occurs when there is a hemorrhage and continuous growth of blood vessels in the retina. So it is often treated with a laser surgery. So diabetic is nararanasan ito ng mga taong diabetic at nagkakaroon ito kapag mayroon silang hemorrhage at patuloy na paglaki ng mga blood vessels sa kanilang retina. So the next is we have retinitis pigmentosa. So this is gradual degeneration of the retina. It can result to night blindness, photophobia, and loss of muscular vision. So sadly, this condition is inherited and not treatable. So pag sinabi nating retinitis is ito yung mga karamdaman na ating namamana at hindi ito maaaring gamutin. So the eighth is the Usher syndrome. So this is deaf condition, which is a combination of congenital deafness and retinitis pigmentosa. So Usher syndrome is ito yung kondisyon na ng pagduling o pagkabulag na dulot ng kombinasyon ng congenital na kahinaan sa pandinig na retinitis pigmentosa. So, the next is the macular degeneration. So, this condition is typically to adult but it can also affect young people. So, this is due to deterioration of the central area of the retina cones. Visual fields are lost but the person can use his peripheral vision. So, the person may be photophobic but affect his color vision. So, macular degeneration is ito yung maaring naranasan, kondisyon na maaring maranasan ng mga matatanda at pwede ring mararanasan ng mga kabataan. So, the next is retrolental fibrolacia. So, typically premature babies who are overexposed to oxygen in the incubator. So, retrolental fibrolapsia is ito yung karaniwang nararanasan ng mga premature babies, lalong-lalo na yung overexposed to oxygen in the incubator. So the next is the optic nerve atrophy, so damage of the optic nerve. The optic nerve carries image of what the eye sees to the brain. And the last one is we have ocular albinism, so a genetic condition that primarily affects the eye, and this condition reduces the coloring pigmentation or